Good morning. Today I'd like to talk about the public health measures in response to COVID-19. I'll give a statement and then we'll open for questions. Up to the 20th of April, Anguilla had 30 confirmed cases of COVID-19 with one active imported case on island. Yesterday, April 21, a case of COVID-19 was confirmed in a symptomatic female resident who had no apparent direct links to any imported case of the virus. Linked to this case, 2 further persons tested positive on the evening of April 21. All 3 persons are currently isolated. In accordance with the World Health Organization classification system, this is, in the first instance, a cluster of cases. Contact tracing and surveillance are underway in order to ascertain the extent of spread, as well as to contain further transmission with the aim of avoiding community transmission. In light of this development, the Executive Council today agreed to implement measures which are in line with Stage 3 of the escalation of measures plan previously passed and will come into effect at 23:59 or 11:59 p.m. today, the 22nd of April, and will remain in force for 14 days in the first instance. 1. All persons other than those providing essential services will be required to stay at home. You are permitted to leave your residence only to seek medical care, including vaccinations, to buy food or fuel, and use banking services. 2, non-essential workplaces will close. 3, all public gatherings are prohibited. This includes the closure of churches, schools, nightclubs, and bars. 4, restaurants and other food establishments are restricted to takeout services only. When customers are collecting food, they should practice safe social distancing. 5, the reintroduction of mandatory social distancing measures in spaces allowed to remain open, including capacity limits and wearing of masks recommended in public indoor spaces and where physical distancing is not possible. 6, closure of ports to incoming passengers. Outgoing movements are still permitted. 7, restriction on visitors to residential facilities, for example, elderly care homes, prison, Zenada Haven. For the avoidance of doubt, unless you are an essential worker, you should stay at home, except to 1, visit your doctor or pharmacy or to get vaccinated. 2, buy food or fuel. 3, make use of banking services. And 4, exercise outdoors for a period not exceeding 90 minutes per day between the hours of 5 a.m. and 6 p.m. These measures are subject to change based on the evolution of the situation and will be reviewed in 2 weeks' time. Vaccination program. The vaccination of the population against SARS-CoV-2 remains critical. As noted above, persons should continue to visit the vaccination sites to get their jabs. Further information will be released, giving details of how we intend to increase capacity and ensure that persons are able to observe safe social distancing protocols. Food and supplies. The shops remain open and are well stocked. We ask you not to panic buy or hoard. Playing your part. The steps we have all been taking are in order to keep us safe. Once again, we urge you to take the simple steps that save lives. Frequent hand washing. If water is unavailable, use an alcohol-based hand rub. Covering coughs or sneezes with a disposable tissue on the crook of a flexed elbow. Avoid contact with persons who are ill with symptoms of acute respiratory infections such as fever or cough. Regularly cleaning surfaces and objects that are frequently touched or handled. Persons with any questions or concerns, that may have been exposed to COVID-19 should call the ministry's hotlines at 476-7627, that is 476-SOAP, or 584-4263, that is 584-HAND. Additionally, persons who have been vaccinated and experience any side effects or adverse reactions are encouraged to report this at 235-4357 or 235-HELP. The Ministry of Health will continue to provide timely updates through our media partners, our official Facebook page, or at www.beatcovid19.ai. Thank you for listening. I'll now open up the floor for any questions. The health team is here, the Chief Medical Officer and the Permanent Secretary of Health.
Good morning. Dr. Webster, you just mentioned the wearing of masks. Is that mandatory right now? You mentioned in public places. Does that apply to government offices as well?
Thank you very much. Yes. Based on our escalation protocols, we will be mandating masks in public spaces that cannot properly deal with social distancing, including government buildings, private buildings as well, that are open to the public as of midnight tonight. Before we move on, just a clarification. I think there may be a little confusion with regard to the 30 cases mentioned earlier. We do not have 30 cases of COVID in Anguilla. There's a question that came up on Facebook just now. We've had 30 cases total since last March, between then and now. Currently, the numbers that we have on Anguilla are the 3 cases we identified last evening. Those are the 3 active cases that we have isolated right now. The 30 cases are not cases as are active in Anguilla. Those are the 30 cases that would have been total in Anguilla since last March.
And Doctor, as you spoke, I got a feel that the island is on a closed down, or almost on a closed down, as you said, that non-essential workers stay at home. How far does this affect government and banks and so forth?
Thank you for that question. The country is on a pause. Banks will remain open. Essential services such as pharmacies, doctors' offices, the hospital. We do want persons to stay at home unless they have to access the food, gas, the banking services, doctor's offices, pharmacy. And this will be in the first instance for 2 weeks.
What we are experiencing is a cluster of cases of unknown origin. We at the Ministry of Health in these press conferences over the last year have been indicating to the public of Anguilla that this could happen. We have been reiterating that certainly there are chances for the virus to come to Anguilla, not only in terms of persons coming in the bubble, who we test and so forth, but also through the illegal movement of people between Anguilla and other islands. And we know it's been happening. So at this point now, we cannot indicate certainly where this would have started, but we are investigating. Certainly as of now, the 3 persons that we are still doing contact tracing, and we will continue over the next 2 weeks. And people have been asking why 2 weeks. 2 weeks is critical because that is an incubation period for the SARS-CoV-2. It gives us a time to pause, to find out what's happening in the community, so that we can begin to step out knowing what the status is in the country. So it's critical for us at this point in time to pause at this moment to figure out what is the epidemiological situation in Anguilla with regard to SARS-CoV-2. So that's why 2 weeks.
And just to further elaborate on that, we see it as, I know persons are panicked, We see it as a very good moment to control the situation while we figure out what is going on. It's a cluster situation at this point in time. We're trying to avoid the dreaded community transmission. What the 2 weeks will do is will shut down whatever is happening in terms of individuals seen and unseen while we do our contact tracing. So we're sacrificing a few days literally to contain the situation, and that's a pretty powerful thing. Another consideration that went into our 2-week lockdown is because we have the variants that are around nowadays. We're not sure what variant this is. Incidentally, we'll be sending some of the samples for sequencing. They are more contagious. So again, we've been more aggressive, so we're not even entertaining that. We're not going to try to get this horse out of the stable. So that is also going to solve that question no matter what's circulating. I see persons online are asking if any of the persons involved thus far were vaccinated, and the answer is no. None of them have been vaccinated, and none of them were vaccinated at this time of this exposure. So just bear with us. You've borne with us before. It's a short window of opportunity to contain the situation. And once again, I think we have to drum home the message that I still believe that this country is quite fortuitous with the numbers of persons that have had their first vaccination already. Most of us haven't completed, but the latest evidence from the AstraZeneca show that even after that first shot, you're 76% protected, right? We've had, on a very positive note up to yesterday, a steady stream of persons coming to get first and second doses, and that was very heartening, and again, just in time. We've been on message. You will see the consistency of the message. We said it's more likely a when, not an if, as long, because this pandemic has drawn out so long. It's more than a year. And we've seen all around us, and we continue to say, we are no different from the other islands. It felt like just a matter of time. The writing has been on the wall for some time. And still, I think the place Anguilla is in, when these other countries fell, they didn't have their vaccination up to the point we had. No vaccination was in sight as yet, so there's still a lot to celebrate. This is still a cluster situation. We're locking it down very aggressively. We're not playing. We're not waiting to see what might happen. And if we do this right, this few brief days, we can have this situation very much under control, irrespective of what the numbers say today. So I want to just say that to the general public.
Does this aggressive lockdown interrupt the vaccination program? Would people be still able to come even though the places are closed down partially? Can they still come for vaccinations at this time?
Well, we're thinking more of it as a pause in terms of the greater cause, not to sound corny, didn't mean to rhyme. But no, absolutely not. We're going full force with the vaccination. That is the hallmark, that is the main part of the strategy now to get this thing under control. So between these measures, these public health measures, and the aggressive vaccination, I think we'll be out of this just fine.
To add to that, vaccination is considered an essential service. The numbers we have now, and we've been indicating that this is a possibility, but I can tell you, if this were to ever happen, I prefer to happen now. We have had over 6,000 persons have their first dose, over 1,100 persons had their second dose. So we have quite a bit of protection in the community, rather than this would have happened last year where we had no protection at all. So I think we still need to get our numbers up, but the protection is there. Even after the first dose, you can have a protection up to 60-something%. And even after the first dose of AstraZeneca, it's possible to stop unknown transmission considerably. So if we ever had to pick a time when this would happen, this would be the time, even though we prefer our numbers were higher. What I can tell you though, when we were speaking about vaccination over the last few months, I think people are beginning to realize now what we were talking about, right? It is impossible for us to predict when this would have happened. But I think because we managed the process so well over the last year, and we've gotten the community to a point where you can now vaccinate, you can see the measures we put in place and the wisdom behind what we're doing. So the science has been guiding us, and the science will guide us again. I think for the next 2 weeks, it is critical that we take a stop and take a pause so we can figure out what is happening to shut it down. I think we had indicated the last press conference I was at, that July 1st was a date that we had indicated we would begin to have persons come in who are vaccinated, who would not have to quarantine and so forth. If we get it right over the next 2 weeks, that July date can still remain. So this pause now is for us to take stock very aggressively to ensure that we have a pretty good idea of what's happening epidemiologically and virus-wise, so that we can begin to ramp back up to open up to some extent on July 1st. So we have our eye on a long game. We have our eye on ensuring that Anguilla benefits in the long term. So for the next 2 weeks is a short pause for us to understand the situation.
So the question was asked about construction workers, and those will continue as we did previously. And guests on island will be restricted to the property. So as you can see from the release, the restaurant services will be for takeout only, so some of those bubble activities have to go away. And as we said, the ports are open for persons to go out, but no incoming activities for this next 2 weeks, starting at midnight tonight.
Mr. Rogers, you said that the persons are asymptomatic. And you said no link to any imported cases. I'm just wondering how wide do you think your investigation will be? Do you think it will be a wider net, a larger portion of persons being affected?
Well, we're still investigating. We can't say definitely yet exactly where the origin was or the etiology, but we are still investigating, so I don't want to give any prescriptive answer just yet. But what I can say is the team has been working very hard through the night. I must commend our contact tracing team who haven't slept since yesterday evening into this morning, trying to track down this. So what we can say at this point in time is we're not yet certain of the origin, but hopefully we can get that information quite soon.
What does this do to our international status? Because I know guests were coming here because we were quote-unquote COVID-free, and I already saw tourists put out something saying she's positive and she got it from a local person. So when you have messages like that, what is the word now coming from the tourism officials or the Ministry of Health?
Well, it is what it is. If in fact she got it from a local person, she got it from a local person. In public health, we don't shy away from those answers. We give the facts. We give the answers to what really matters, and I think the people of Anguilla have appreciated the Ministry of Health for being very factual and very straightforward. So if indeed it was contracted from a local person, that is what it is, and that is what we have to report. But I think over the next 2 weeks, our aim is to shut it down so that after that period of time, we can say there are no cases on island. The cluster has been covered, and then we can move on. Well, it's not a guest. It's a person who's been living here. It's not a guest. It's a resident of Anguilla.
Okay, are you confirming it is what it is? Is that you're saying that yes, the person contracted from a local person?
That's what I'm saying.
Okay.
Just to confirm, the person is not a visitor. The first index case last night was not a visitor. It is a resident who has been here since last year, who has been living among us, moving among us. This is not somebody in the bubble activity. This is somebody who's been here since last year. And we are now doing a contact tracing to ensure that we have all our bases covered. What we can assure the public is that we have certainly all the persons right now isolated and quarantined, and we are doing the other testing to ensure that persons as well get the tests that are necessary to get their status cleared. What we can indicate, we have the Premier in his presentation indicated our hotline number and our other contact numbers. If there are persons who think they've been exposed, please make contact and we will take it from there. There's no need to panic. We have a way of dealing with these things, and certainly from a Ministry of Health standpoint, we will ensure that everything is done properly. Dr. Aisha, I'm going to ask you, yes.
The difference between the cluster and the community spread, really you can think of the cluster as one step before, in the sense that there were links, there was a common exposure in some social gathering and so on. With community spread, which now has 4 levels, 1 through 4, 4 being the worst, you're thinking of widely disseminated disease, you lose those linkages, it's just all over the place. So if you think of it that way, alludes to a slightly better situation when you have some degree of control and some links that you can follow. When you have it so dispersed in your community, that's community spread, and you have from low incidence, that's level 1, to 4, where it's really just rampant, right? So we're here, and that's why we're trying to manage the situation. We're at the cluster phase, and we'll see what the next few days and weeks will tell us in terms of the extent of spread, and if there are more clusters or more spread onto community spread. But at this point in time, we can say definitively this is a cluster, and we treat it as such. The measures will abate whatever is happening. However it's qualified at the end of the day, the measures that we're putting in place urgently will stop transmission regardless of the categorization. So that's why we're anxious to get on that. Another thing that has come to the fore, and alludes to the question you asked before, in terms of how extensive the community, the contact tracing will be. And the answer is it's as wide as it needs to be. You define your contacts, you look at the person's activities. We would have said several times before, your contact is basically the positive person who is in contact with this person less than 3 feet, more than 50 minutes at a time, extensive physical interaction and that kind of thing. So we've already seen that the persons involved are quite active socially, and that also begs the question of locking this down sooner than later. If you had a situation where there's a couple or a meeting another couple in a different villa or something like that, where the contacts were limited, then we would have been less urgent in our action. But that's also something that has factored in terms of our sense of urgency, and it's just managing this situation. So regardless of what's going on, what we are proposing now will contain and will prevent further transmission.
One of the questions has been asked as well about residents returning home to Anguilla. As of this point in time, for the next 2 weeks, ports are closed. And that is for a couple of reasons. We're not allowing anybody to enter because we need to get a sense of what's happening on island. And secondly, because of the limited resources we have. If we're going to be contact tracing and testing for the next couple of days and so forth, we need all the resources on island to ensure that we have a good idea of what's happening in the country. We cannot split our human resources between contact tracing and testing on island and at the ports at the same time. It's just not possible, and certainly we want to ensure that for the next 2 weeks we do this correctly. So for the next 2 weeks, just like last year, we ask people to bear with us. It's only 2 weeks until we can get a grip on what's happening.
Just to follow up faster on that, which means then that no tourists would be entering the island within the next 2 weeks, correct?
That is correct.
Okay. Doc, from last year to now, I know we've had one variant. Are there any indications saying that we have a second variant in Anguilla?
Well, to answer your question, incidentally, the last batch of imported cases we had, and so that could not be considered variants in Anguilla because it was a contained situation of imported cases, and we were contributing to the literature. Those were actually the UK variant, but those were imported cases with no onward transmission. What we propose to do with these cases as they emerge, we will be sending them for the genetic testing, so we should have that information within a week or so. To CARFA, and they send it on to the University of the West Indies, and they have been doing the genomic sequencing for the Caribbean.
And the questions asked about fishing. We will not restrict fishing, but also with that, border control is now something that will be ramped up again to ensure that we have protection from persons coming in illegally.
What does this do to government finances? Because we know border protection is quite expensive, and we know funding stopped from the UK. So what does this do? Will we reach out to the British government again?
Well, we have to protect the people of Anguilla, and whatever that entails, we have to do that. So right now, the funding stopped for the special constables, and the government of Anguilla committed to continuing that. And, we have to, however we find the financing, we have to make sure that we protect the people of Anguilla. So that's why, we thank the health team for, their commitment to this, their hard work, and taking that responsibility. This administration will act responsibly to make sure that we protect the people of Anguilla, and certainly, we need to find funding, we'll have to.
From a Ministry of Health standpoint, we always look at economics. You cannot have a healthy population without having an economically viable population. Certainly for the next 2 weeks, we think that protecting the economy is also necessary for closing. Closing down the country is also necessary for protecting the economy. We understand that the difference between a cluster and community spread, and our actions right now are geared at preventing community spread so that we can contain the cluster so that we can open back up rather quickly. That is a priority right now. That is the goal right now. Our only goal right now is to ensure that there's no community spread. Once we can ascertain that, we will be able to open back up.
I have a question from online. It says, what about residents who are already en route to Anguilla?
Well, that's a very good question. At the end of the day, we have to ensure that the country itself is protected in terms of the borders and reintroduction of any of the new variants or any of the new issues. So we understand that. We would ensure that persons who cannot get in before tonight, please postpone your travel. Just postpone it for 2 weeks.
If I understand, Doc, this person was in Anguilla for a year, you said. Are you saying that? They were here since last year? 6 or 7 months. And of course, they would have been tested and quarantined during that, when they entered. I mean, for that length of time, how real is the risk that they could have contracted this problem long before now?
Oh, there's no way. This is not an old case. This is an acute case. This is a new situation. That person cleared quarantine, and she's symptomatic, and the test and the results of the test, and even the history and the symptomatology of the person she was in contact with, that's an acute infection, right? There are stories and theories about how this could have jumped into the local community at this point in time. Viable theories, but the point is we are where we are, and this is a new infection. She didn't come in with this in October, certainly not.
One of the good things about our machinery is that we can detect the recent nature of infection. We can detect whether an infection has been quite recent, whether it's an old infection, whether it's a resolving infection, or whether it's an increasing infection, by something we call the cyclic threshold. So we can have a pretty good idea whether this person is a new infection or old infection, and certainly the evidence is that this person is a new infection.
Just a question, Mr. Rogers. You mentioned that it's a cluster and not community spread, but I mean, in my mind, it's difficult not to think of it as a community spread, because if you have a cluster and that person has the virus, you don't know who or what other persons they may have associated themselves with, and those other persons may have gone on and mingled with other persons. So to me, it's easy, for community spread to happen like that.
So that is the point of the investigation. Remember, we opened by saying in the first instance, this is community spread. A cluster. In the first instance, this is a cluster, and then I went on to elaborate that the difference in terms of the categorization is the amount of the dissemination and whether or not you're seeing links. So now these persons are linked together with some social gathering, similar symptoms. We say this is a cluster, and part of the investigation will see how many within that interaction or their associates are part of that cluster. It may be in the course of our investigation we find some dispersed cases here and there. That will allude to the possibility of community transmission. Let's hope not. But at this time, we can say this is a cluster. We're investigating it. In the meantime, as we investigate it, the measure we are doing, the pause for the cause, is going to abate whatever this is. We're hoping it stops at this cluster phase. It's possible. We may find some more cases that are not linked to anyone. Then that's a bit more troubling. And then we have to talk about degrees of community spread. But as we speak here today, at the time of speaking, we have a cluster, and we see how large that cluster is, and we qualify further if it's any kind of community transmission, and it's a waves and a terminology, and it will go from there. The most important thing to take home while we're doing this aggressive measure now is that whatever is going on is going to be stopped by what we are proposing to do.
I think the responsibility of the public is critical as well. We know this virus spreads a lot through personal contact, through mass gatherings, through respiratory ways. So the measures we're putting in place is to draw those things back so that the virus doesn't have a chance to spread. So the measures we're putting in place, the public is very important in following these instructions, the closing of the bars, the closing of other areas that we have possible mass gatherings, churches and schools, the social distancing, the wearing of masks in some public areas. These are the things that will help break the transmission. In addition to getting treatment early, if you certainly have symptoms, isolation, treatment, and so forth. So these are all issues, all protocols taken together. It's not one of them. It's all of them taken together will be what will break transmission. At this point in time, there's no way to social distance worshiping safely. It's not possible. You're going to be singing and praying, and in fact, if you recall, in the U.S. Last year, most of the spread was in churches. There was this one guy who infected an entire choir because he sang in a choir. There's nowhere to worship safely in social distance. So we understand the issue, but at this point in time, because of the public health emergency, because of public health issues, we have to put a stop to some of these activities.
Just repeat the stay in place for persons in the hotel again, please, for the public.
Yes, because of the activities that we are looking at, we are indicating that all persons at hotels must stay in place at this point in time. The bubble activities in terms of travel outwards and so forth, all of those things will cease until further notice. Yeah, I think the chief medical officer alluded to the fact they are looking at some theories of how this could have happened. We don't know yet, but certainly we're going to track down every possible option. One of the things we have always indicated is that the protocols are only as good as we work them. And we have indicated over and over that the protocols that were put in place for the bubble activities were for the protection of the guests and the protection of the community. But protocols only work as well as we manage them. And there have been questions online about in terms of could this have been gotten in a bubble? We don't know. It's quite possible if protocols weren't followed. But at the same time, we will look into these things and ensure that persons in the future realize the importance of ensuring that they follow protocols and the critical nature of listening to the science. When we presented these things over the last year, we were not doing this out of some fancy notion that, we didn't just come up with these things. These things were designed based on science. And if you don't follow them, it's possible that things can happen.
A question on the closing of the ports. We know that on a limited basis, ferries and planes go to St. Martin to transport goods to Anguilla, back and forth. Can that still continue, or is it limited, or is it closed?
No, the closure of ports never covered cargo and movement of stuff. It never did, and it never will, because of course it's critical that we continue to survive, food, movement of goods and so forth. But what we will say is that the crew must maintain the protocols because they're a critical aspect of this. And they have been working, most of them are working very well for the last year. We have not had one positive case of a crew member who has traveled to a foreign island, whether it's on a boat or a plane. And we want to thank them. Certainly, we encourage them to continue to work hard and to ensure that they protect Anguilla. So no, cargo boats and vessels will not fall into this ban.
Again, underlying question. The question is, how many people have been contacted so far doing the contact tracing?
Actually waiting for that report, but it's in excess of 30 persons at this point in time, I can see off the top of my head, and it's still going, still ongoing. So that report will come in at some time, and we'll keep updating you.
Yeah, just to reiterate, persons who are on the way to Angola are arriving today, they can arrive today. We will not stop anybody from coming today. The closure of ports is midnight tonight. So anybody who will be traveling to Angola tomorrow, please postpone your travel. You will not be allowed to enter Angola after midnight tonight.
Any other questions? Yes.
Certainly I want to thank the people of Angola for the support over the last year, for the program, for the protocols, and for me personally. As you can tell, I did not have a stroke. As you can tell, I did not have an embolism. As you can tell, I was not flown out on an emergency medical evacuation. What I can say, thanks to the Premier and my supervisor and my friend, as you know, as public officials, sometimes we have to make certain information public as public officials. Many persons in Angola know I sing. I'm a vocalist. I also play saxophone, and I talk a lot, as you can tell. And the Premier was at a concert I was at a couple Sundays ago, and my voice wasn't behaving very well at all. And following that, an executive council 2 days after, he picked up something was happening, and we went to his office, and he found some polyps on my vocal cords. I was asked to remain at home by him. He put me on a lot of medication so that my polyps can resolve, so I can be able to sing again, so that I don't have any permanent damage to my vocal cords. So I have been at home resting. I have not even taken my second dose as yet. My second dose will not be taken until next week. I was supposed to take it last week, but because I've been out on sick leave, I haven't taken my second dose as yet. I will be taking my second dose next week. So I want people to realize there is a lot of misinformation out there. And there's a reason for this. There are a lot of people who are trying to put a spanner in the works of Angolians, and are trying to put a spanner in the works of Angola development for many different reasons. Some of them have their own selfish reasons. I will not go into that, but I will say, I want people to realize that you have to try and get information from the most credible source. When persons are going to go down the road to as far as to say that I have been flown out because of COVID vaccine without even knowing the details of my health situation, without even knowing the details of my personal situation, it is not only alarming, but it is disconcerting. And it is certainly something that I wish Angolians will take a step back from. It's not everything you hear in Angola is true. In fact, most times, most things you hear in Angola is not true. So what I can tell you, I am doing much better. I'm doing fine. The advice I got from the Premier, my doctor, has been very good. He has put me back on the road of recovery. As you can tell, my voice is much better than at the last press conference we had. I was barely speaking properly. I want to thank persons who supported me 100%, my family and my friends. And I want those persons out there who have been on the other side disclaiming and making disparaging remarks, I want to thank you as well for the resolve and for the strength you have given me to ensure that I continue my hard work and continue to work on behalf of the people of Angola. Thank you very much.
Someone who's away on medical, treatment, they're wondering what their position going to be when they're returning home during the 2 weeks. What's the status on persons on medical leave abroad?
If there are persons who are abroad right now who are abroad on emergency medical treatment, whether they were taken out by ambulance or not, and have to return on the ambulance, we will make arrangements for those people to come back because they'll come back to the hospital. At this point in time, those persons who are not coming back to a secure facility, we'd have to look at that on a case-by-case basis, but the ports will be closed, so there'll be no way for planes to come in or boats to come in. So we will ask you to shelter in place until further notice.
Yeah, I was just asked to make the statement that the Minister of Tourism and his children have not tested positive for COVID. So that's another one of the rumors going out there. I would just like to say once again, the most immediate way to get out of this situation, to avoid all of these public health measures, restrictions, economic hardships, is through the vaccination. So let's keep it going. And as we said before, this is a way out of it. And here we are again faced with another situation reminding us, and it's coming closer and closer to, at our heels and snapping at our heels. We just need to get out of this in short order. So.
I want to thank you all for coming. I want to thank the Permanent Secretary for coming, even though he's still officially on sick leave. He didn't explain all the damage that was caused to his vocal cords, but certainly he is improving, and I can hear that. So I look forward to taking another look in the near future. Thank the CMO for the constant work to make sure to keep us safe. This is an unfortunate situation. This tells us how close we were doing so well, and then this happened. But we've always said that this can happen and will happen, because unless we just close down and stay in a bubble continuously, we are exposed to importing the virus. Now we're seeing that the virus is here and there's no direct link to it coming in as yet. We haven't found that as yet, but due to the investigations going on, the contact tracing, that's what we're trying to ascertain. So it's unfortunate that we have to go into this pause, but it is essential to protecting the health of the community, because the last thing we would like to have, that we don't want to see happen here, is we don't want to see that this gets rampant in Anguilla. Our healthcare system cannot take that. Our financial system cannot handle that, and certainly our people do not deserve that. So we'll do this. Everybody has to play their part. Stay home if you don't have to come out, and for the next 2 weeks, we all can do that, and hopefully we curb this. Even if it has gone out of the cluster, we curb the spread of it. We get back to good health. We continue to do what's necessary, and go out and get vaccinated, because that's how we can at least ensure that our immune system is up, our health is protected, and we can get back to life near normal as possible. So I want to thank everyone again. Thank Radio Anguilla, the Anguillian, Lloyd Live, Dites. Thank our Ministry of Health for being here, and we'll continue to be vigilant. We do hope to have frequent briefings to let the public know where we are in regards to the contact tracing and other measures if they become necessary. So I thank you all again, and may God bless you, and God continue to keep Anguilla safe. Thank you.